Today, in most areas of the world, immunization records are still maintained with pencil and paper. Even if records are maintained on a computer, a database is not used that will make these immunization records available to healthcare workers outside of the originating organizations. ChildVac has developed a durable, lightweight, handheld device. The device will hold a database that stores vaccination records for children. Each child's fingerprint will be stored as a unique field with his or her vaccination records. ChildVac has had the privilege of consulting Dr. Nate Smith.
Dr. Nate Smith, Deputy Director for Public Health Programs and State Epidemiologist at the Arkansas Department of Health. In addition to the work here in Arkansas, I've worked in East Africa, particularly in Kenya and Tanzania, with HIV treatment programs as well as general medical and infectious disease care and treatment. First, I believe this project will provide ministries of health with critical information for vaccine surveillance, understanding their vulnerabilities and areas of need. Second, it will provide families with the information needed to make best use of the vaccines that are available through their national programs, making sure those immunizations are up to date. And third, it will allow those who are involved in outbreak response critical information on who's been vaccinated, who has not been. Currently, those types of information are not available or not available in anything near real time.
ChildVac configured and deployed a Windows embedded Compact 7 operating system image and placed our application on top of the image. To use the device, first you scan the patient's fingerprint. If it's a new patient, the new patient screen will come up. You select Add. Then it wants you to select which finger you're going to fingerprint. We have different options so that we can have several fingerprints stored. We scan the fingerprint twice. Underneath the fingerprint is a bar to measure how well the fingerprint has scanned. When we get good scans, it takes us back to the new patient screen. Here we add the child's name, address, birthday, and their relative. We can also scan the relative's fingerprint. The child's age is very important. That is what will determine what vaccines the child receives. You scan the child's fingerprint again. This serves as a precaution to be sure that we have the right child. Now you can see at the bottom under notices which vaccine the child needs. You can also look at the patient history. For a new child, we do not have any history. We have the capability to select the vaccine and then input the lot and label number. We can use a barcode scanner to input this information. Now you can see that the vaccine that was just given is off of the list. ChildVac gives us electronic medical data that is ready to use by governmental agencies and humanitarian organizations. ChildVac is working with a company in Asia that will help us design our 7-inch tablet with a fingerprint scanner, a camera that will work as a barcode scanner. We'll have 3G, Wi-Fi, and GPS capabilities.